Number 5. Rotator cuff injury. Four main muscles, supraspinatus, infraspinatus, teres minor, and subscapularis comprise the rotator cuff, which surrounds and stabilizes the shoulder joint. Shoulder pain when you reach behind you, overhead, or out to the side may be a sign of a rotator cuff strain. It typically results from repetitive overhead activity, such as swimming, throwing a ball, and overhead shoulder movements like military presses. This can lead to rotator cuff strains when done repeatedly over time. How to stay safe. Strengthen your rotator cuff muscles as part of your upper body program. Use a good posture and avoid repetitive overhead exercises with a weight that you know is too heavy. And avoid lat pull downs behind your neck. Do lat pull downs from the front instead. Number 4. Patellofemoral syndrome. Pain under the kneecap that worsens from running, walking downstairs, or sitting with bent knees for long periods of time could be a sign of patellofemoral syndrome, also known as runner's knee. You may also hear a crunching, creaking, or grating sound. You can get this from running, jumping, or squatting. A change in activity level, such as increase in running mileage, can contribute to the pain. Patellofemoral syndrome occurs when the bones in the lower leg are not lined up perfectly, which causes an abnormal gliding between the patella, the kneecap, and femur, the thigh bone. This misalignment can lead to wear and tear between the cartilage and surfaces of the bones, causing pain. How to stay safe? Keep the knees healthy with exercises that strengthen the quadriceps and hip flexors. Seated and lying leg raises are often prescribed for strengthening the quadriceps. Also avoid kneeling or squatting repeatedly. Number 3. Bicep tendinitis. Pain in front of the shoulder and upper arm weakness may be a sign of tendinitis, an overuse injury that typically occurs from repetitive motions. Bicep tendinitis refers to the inflammation of a tendon that attaches your upper biceps muscle to the bones of the shoulder. Impingement and rotator cuff damage often accompanies bicep tendinitis. You'll feel pain and tenderness in the front of the shoulder that worsens with overhead lifting. Pain can also move down the upper arm bone, and you may feel an occasional snapping in the shoulder. How to stay safe? Make sure that you take enough rest time between workouts. Check your posture and form, since poor posture increases the risk of bicep tendinitis. Low back strains. A sudden sharp twinge in your lower back during your workout could be a sign that you've overdone it. Squats or deadlifts with improper form wreaks havoc on the lower back. You can suffer strains or even worse, nerve compression and disc herniation. Twisting motions or sideways bends can also strain your lower back. How to stay safe? Get your form correct before adding weight. Beginner weightlifters should do the leg press or hip sled first before trying squats. If you're unsure of proper form, ask a qualified personal trainer for advice. Ankle sprain. Twisting an ankle doesn't just happen running outdoors. Jogging on a treadmill in a gym can also result in an ankle sprain. The biggest problem running indoors on a treadmill is losing your focus on, say, a phone or an MP3 player and accidentally stepping half on and half off the treadmill while the belt is still moving. This forces you to jump off the treadmill quickly. If you land awkwardly, your ankle may roll in an unnatural direction. Running outside on an uneven terrain or up and off curves also increases the risk of an ankle sprain. How to stay safe? Most treadmills have a clip you attach to your clothes that stops the machine if you fall. Make sure that you use it. If you run outdoors, stay on a level sidewalk or at a park. Look for paved, even walkways because uneven terrain and potholes can be a problem.